Well, this is a great honor, and I have to tell you that the Rising Leader Award from WGHA is so important. And the reason it's important is really on two sides of the coin. One is for those of us that have been in this work for decades, needing that continuing inspiration. And the other side of the coin is for those leaders who have yet to be discovered, to know that there's space for them to express themselves and deliver their leadership to solving the roughest and toughest challenges in global health across this planet. From the rising leaders, we want to see that they're as smart, or in this case, smarter than we were in pursuing our efforts. We want to see from the rising leaders that they were as passionate, or in this case, more passionate than we were in getting to where we are and the challenges that we're facing. And so as the president and CEO of SightLife, this opportunity is very, very personal. And it gives me immense pleasure to tell you about Josie Noah, this year's recipient of the WGHA Rising Leader Award. Josie directs SightLife's global surgeon training and patient care program. She trains surgeons worldwide, from India to Mexico, Asia to Africa. She is the embodiment of SightLife's mission to eliminate corneal blindness by 2040. As you can see from the photos of her in the field, she shines. Blindness in the developing world has a crushing impact on a person's life. They're not unable to work. They can't even learn how to read many times. They need constant attention. And often blind people are shunned by their community. Josie passionately wants to change that. She runs the largest, most successful corneal surgeon training program in the entire world from here in Seattle, which she built. That's right, that's right. Which she built from the ground up a little more than 2 years ago. During that time, she has trained nearly 20% of the corneal surgeons in the country of India. Additionally, under Josie's leadership, SightLife has trained nearly all of the corneal surgeons in Nepal and Ethiopia in advanced procedures for sight-restoring surgery. As a result, those surgeons are now far more effective and can offer higher quality transplants to their patients. Josie is passionate about engaging diverse stakeholders and empowering local communities to encourage lasting change, not just temporary change. She's even created a program to train surgeons to mentor others. Josie doesn't hesitate in promoting the success of others and is always the first person to offer her help in connecting the right people with each other with exactly the right mission at the right time. Her goal is simple: to be a partner in improving the lives of people everywhere. Really the embodiment of WGHA's mission. The word partner is significant to her because her goal is to work with her community to help them reach their potential in life, whether it be professional development or facilitating surgeon training to restore sight. And let me share an example. In April, Josie flew to Ethiopia to train all of the corneal surgeons in the country. Now, unfortunately, that means there's 8 of them, all 8 of them. But guess what happened? When people knew, when doctors knew that this training was available, more than 40 people showed up in the class. We were planning for 8. Somehow, Josie figured out how to accommodate all of them in a classroom built for 20 and feed everybody during the training. We still don't know exactly how she doubled the food in 30 minutes. There might be a parable about that somewhere. But this is how creative Josie is. During the surgery, when they're training the surgeons and they actually have a patient on the table, the day after that, or during the surgery, in the classes, the power actually shut down. It's like you out there in the dark, and you're doing surgery, microsurgery, to help a person who's blind have their sight restored without missing a beat. Josie whipped out the flashlight on her phone and told others to do the same. And the next thing you knew, the surgeons were fine and had the light they needed to continuing the surgery and the training. And they did a fantastic job for those patients. Over the course of those 2.5 days, Josie trained 38 ophthalmologists and corneal surgeons in Ethiopia and helped restore the sight directly to 18 patients, all without breaking a sweat or dropping a ball. Josie has an unwavering commitment to mentorship and professional development of her team and peers. And I have to say, I'm a personal recipient of this, as she actually mentored and trained my son as he got to work alongside her this summer. Going beyond her demanding leadership role in surgeon training and patient care, Josie voluntarily takes time to work with her colleagues at SightLife and beyond to help them maximize their strengths and optimize their roles at SightLife or wherever they work by leading professional development sessions. This is a reflection of Josie's belief that when you understand how to align your passion with your work, you can make an incredible difference in people's lives. Josie Noah inspires me. She's a teacher, a partner, a listener, and she's just 33 years old. Imagine what she's going to do. When her colleagues describe her, impactful is the first word they use. They also describe her as innovative, collaborative, professional, all these powerful words. But they also describe her as kind. What a lovely description, kind. It is my great honor to present Josie Noah with the 2016 Pioneers of Global Health Rising Leader Award. Josie.
Thank you, Monty, very much. To the team at Washington Global Health Alliance and members of the selection committee, I am humbled by this honor. It's amazing to be in the room this evening, surrounded by those who have dedicated their lives to solving some of the world's most pressing health problems. Among them, many friends and mentors who I am indebted to entirely for the work that I get to do. I'm grateful to have the opportunity to work at SightLife with a team who is passionate about eliminating corneal blindness. The success of the surgeon training and patient care program is because of the heart and intellect of two groups of people. Claire, Allie, M, Brian, Sumi, and the rest of the global health team at SightLife, and our surgeon training faculty who volunteer their time and talent. Thank you to my family, many of whom are here tonight, who serve as my constant champions. My parents inspired me with stories and pictures from their Peace Corps service in the 1960s. It taught me from an early age, yes. And they're here, too. And taught me from an early age to be a global citizen. And to Tim, my husband and best friend, thank you for always dreaming with me. As a little girl, I never dreamed of becoming a doctor, or even of working with them as I have the privilege to do now. But I did dream of making the world more beautiful. This past April, on the last day of an outreach program in rural Ethiopia, a father came in with his child. Adisu, a 6-year-old boy, was bilaterally blind. His corneas were protruding and completely opaque. The nurses knew there was little they could do for Adisu. In Ethiopia, as you heard earlier, there are only 8 trained corneal surgeons, and the nearest one was 500 kilometers away. Can you imagine if this was your son? Without surgery, Adesu and thousands of others like him are not able to attend school. They become fully dependent on their family and have little opportunity to reach their full potential. We started the SightLife Surgeon Training Program because we knew there was a shortage of corneal surgeons in the world. In India alone, it will take 20 years to train the number of corneal surgeons needed with the current training model. We can't afford to wait that long. So what do? We change the system. SightLife is contributing to the democratization of medical education, which has the power to cut that time in half. We believe medical education can be redesigned to be competency-based rather than time-bound. Case studies and patient simulation reduce the need for in-person training, and at SightLife, we've taken a 24-month training program and reduced it to 3 months with surgical outcomes that match those of a longer program. But it can't stop with subspecialist training. We have to employ the same methods to train ophthalmologists, general practitioners, optometrists, vision technicians, and community health workers in the identification and management of corneal disease. The more people who can identify a disease and provide early treatment, the better the prognosis. How many chronic diseases could be managed or eliminated if we democratize medical education? How can this community in the room tonight work together to change medical education to ensure that more individuals are treated earlier so that they can live healthy lives more full of possibility? This is the world we imagine at SightLife, a world in which Adesu is never a lost cause, and in which his world is more beautiful. Thank you.
So I'm going to say how humbling and inspiring it is to be here tonight. It's my honor to introduce the Award for Impact. PwC is sponsoring tonight's event because we are committed to global health and the international development space, and we recognize the incredible work that is occurring in Washington and with our partners here. We work to bring PwC's resources, including over 180,000 employees in 157 countries from around the world, to help many of the organizations in the room tonight to solve some of the world's most intractable problems. Dr. Steve Reed, founder, president, and chief scientific officer for the Infectious Disease Research Institute, follows in the footsteps of luminaries in our community, like PATH's Jane Hutchins, the Center for Infectious Disease Research, Ken Stewart, and the founding chair of the University of Washington's Department of Global Health, King Holmes. Dr. Reed is our 4th Award for Impact winner, fitting as he nears 4 decades of working in global health. Since his bio alone could take the next 5 minutes to read, we asked Dr. Reed's colleagues to share insights into who he is and what he's most proud of. They say he's a tenacious problem solver. He doesn't give up easily, even when he faces significant challenges. Perhaps that's best illustrated by his work leading the teams that took 2 notable tuberculosis vaccine candidates from benchtop to the clinic. What you may not know about Dr. Reed is that he's a farmer and a gardener. He loves to cultivate and is always thinking of the next thing that he or Idri could do. He's driven, passionate, opportunistic, and proactive, and he works diligently to build relationships that foster collaboration. He's an idea generator, and he'd have to be found and And you have to be, because he's founded and led an organization poised to celebrate the 25th anniversary next year with more than 125 employees. The nature of global health is interdisciplinary, and when he's asked how he describes his work to non-scientists, he generally responds that his goal is to make products, put them in a bottle, and deliver the products to the people who need them most, whether it's a new diagnostic, a novel vaccine, an adjuvant, or a new formulation. He's less interested in basic science that doesn't lead to a product that can prevent, diagnose, or treat infectious diseases. With that focus, IDRI has more than 13 million leishmaniasis, leprosy, and Chagas disease diagnostics on the market. Under Dr. Reed's leadership, IDRI has conducted 13 clinical trials for vaccine candidates, and IDRI scientists have screened more than 500,000 compounds, feeding a pipeline of new drugs for TB. Dr. Reed and his wife, Marianne, have 3 children and 2 grandchildren who he clearly enjoys. So please join me as we celebrate the remarkable accomplishments of Dr. Steve Reed, our winner of the 2016 Award for Impact.
I was just saying I wish I could play the sax, but it's been a great evening, and Lisa, you really put on a good show. I really enjoyed it. And thank you very much. We're pleased to accept this award. I'm pleased to accept this award on behalf of IDRI and the global health community. I grew up in this state. I've always thought I'd be a farmer in Walla Walla, Eastern Washington. But path led me to Brazil, and actually started working with parasitic disease at Whitman College back in the 70s. So that love took me to Brazil. And I was a laboratory geek. And when I was working with my medical colleagues at Cornell Medical School and saw that they were still holding down kids and sticking a needle in their bone marrow to diagnose a parasitic disease, and I read about this in textbooks, it's been going on for 100 years, I thought we should do something different. So coming back to Seattle in the 80s was the opportunity to do that. This town at that time was incubating biotech, and I instantly fell in love with that because, as you just heard, making products, as in farming, was what I always wanted to do. So Immunex was one of the first biotech companies. They opened the doors to me. Path, Gordon Perkin, helped me to realize the first diagnostic test that we developed for leishmaniasis. And now there's no more bone marrow biopsies taking place for this disease around the world. Millions of kids have gotten our single drop from a blood diagnostic test in Bangladesh, India, Brazil, Africa over the last 30 years. So we're having a lot of fun as a nonprofit biotech, working with pharmaceutical companies and taking advantage of the vibrant global health community here in Seattle. It's been great. And Lisa, you're right. There are a lot of states that would like to have what we have. You mentioned the Sanofi Gates funded global health vaccine initiative. When a big company like Sanofi Pasteur wants to make a difference in global health and develop adjuvants, they come to Seattle for help, and we're very happy to incubate that GHVCI initiative at IDRI. But we also have another company who's expressed their trust in us, and that's Merck. And tonight we have 7, or 8 out of 8 total Merck fellows here. Merck has a global fellowship program, and every year they get to choose where they're going to go. And I don't think anywhere or any place has ever received 8 all at once. And we've got them working on projects ranging from tuberculosis to HIV, et cetera. Yeah, in fact, would you please stand up, the Merck fellows? I don't know if you can. These very generous individuals are from around the world in the Merck community, and it's just a great program. So I really want to thank my IDRI colleagues, most of all, people that have been with me for a long time. There's many of them here tonight: Anna Marie Beckman, Marie Kohler, Derek Carter, Winston Wickham. They've been with me for a long time, and I really have to thank them. And Lisa, WGHA, I mean, it's been tremendous working with you all. and with other friends in the room, Guy, King, Kerpaloy. Thank you very much.
Innovation. The word itself is loaded with hope and possibility. The Global Good Fund, managed by Intellectual Ventures, the winner of this year's Outstanding Global Health Organization, is drawing on the power of invention to tackle the humanity's toughest problems. Global Good is a collaborative effort between Bill Gates and Intellectual Ventures. They combine Intellectual Ventures' unique invention prowess with the expertise of leading humanitarian organizations, forward-looking governments, and commercial partners that share their vision. Together, they invent, develop, and deploy commercially viable technologies that improve life in developing countries. Innovation is the weakest for the world's poor markets, where the potential return on investment doesn't offset the costly, high-risk R&D needed to tackle life-threatening problems. As a result, the abundance of technology invented for the world's wealthiest markets often isn't applicable, accessible, or affordable to the low-income countries. Global Good takes a different approach. They invent technologies that are affordable, appropriate, and accessible, meaning the product must be low cost, it must be easy to operate, and work in a low-resource setting where electricity is often unreliable, and it must provide a solution to a problem that exists in that setting. For example, about a fifth of the vaccines in poor countries spoil before they can be used due to limited access to power and refrigeration. What does that mean in real terms? The story about Ndeye Usutu. She's the chief health officer at a clinic in rural Senegal. Because there wasn't a way to keep vaccines cold, she spent at least 2 days a month walking or driving a donkey cart many miles on rough roads just to get the ice and vaccinations to bring back to the villagers. Global Good invented ArcTech, a super thermos that can store a month's supply of vaccines for a village of 6,000 people without electricity. To date, more than 200 units have been deployed, including a collaboration with PATH in Senegal. Estimates are that more than 8 million children could ultimately benefit. Here's another cool example, the Mausi container. This durable 10-liter container was invented specifically to streamline the collection and storage and transport of milk in developing countries. The unique design is helping smallholder farmers and really other low-income stakeholders in the dairy value chain maximize their yield and reduce costly spillage and spoilage. Milk is their livelihood. Failing for success is the mantra at Global Good. They believe that while failure is a part of taking risks, it's also a tool for learning and a foundation for which to build on the next idea. Global Good was conceived by Bill Gates and Nathan Myhrvold. Nathan, who is one of the region's true visionaries, is here tonight, along with Maurizio Vecchioni, the charismatic leader of Global Good. Nathan and Maurizio were inspired by your team's work. Ladies and gentlemen, will you please join me in welcoming our 2016 Outstanding Global Health Organization, the Global Good Fund.
It is, though, truly humbling, and I think some of the predecessors on this podium said that, to be with you, because one of the key things that we've discovered in the business of innovation is that it takes a village to innovate. And our job is possible because of the great team and the great employees we have, but it is especially possible because of the mentoring that all of your organizations have given what is essentially a global health startup in this community. And we couldn't have done it without you and your recognition tonight. I'll accept it on behalf of our team and our sponsors, but it really is recognition to this community that can mentor and grow something new. I also wanted to give Nathan some credit, because this was a grand vision. And to me,
he clearly wants a raise.
And to me, it's been inspiring to work for you and trying to do this.
So, I think there's considerable irony in us being recognized in part for our cold chain awards when Mauricio and I are like the two least cool people here. And then, actually I thought about that, I thought, you know, we're also not the hottest people here. So we are living testimony that the lukewarm can change the world. Yesterday, I was speaking at the GeekWire Summit, which is all about the Seattle startup community, and they asked me a bunch of questions, sort of comparing the Seattle startup world to the Bay Area, Silicon Valley, which is, of course, way more famous and way more central. And I said, well, yeah, the startup scene here is really good, but I said, you know, when it comes to saving the world, Seattle is actually the center. That's because of all of you here and all of the people in your organizations. I can't think of any better city for us to be in, to reach out, and we've worked with many of the organizations here, and if there's some we haven't worked with, contact him. But it really is amazing to have a group of people that is focused on solving impossible problems. Now, I used to be in the tech industry at Microsoft, and the tech industry is great, but it's about making tools and toys for the richest people on Earth. And you make money that way, actually. But while that tools and toys have transformed all of our lives, it's fun, but our lives didn't need transforming. We weren't right on the edge of starvation. Our kids didn't have the challenges like the story of the Ethiopian child with blindness. We don't have those things. The people who need their lives transformed aren't us. The people who need their lives transformed are the billions of people at the bottom of the pyramid. And it is so amazing to be in a community of people dedicated to fixing that problem. And so I'm humbled to be here tonight with you all. So we want to thank Bill and Melinda and the Gates Foundation and, of course, all of the folks back at Seattle back in Bellevue, that make us look good and let us come up here. Thank you.